So I'm Ahi Wi Hongi. I'm from Ngāpui in the far north and Ngāti Māniapoto in the King Country. And I live here in Wellington. And I work for Gender Minorities Aotearoa, which is a national organisation for transgender, takatapui and intersex people. And also the New Zealand Prostitutes Collective, which is a public health organisation, also a little bit like a sex worker union, but technically not a sex worker union. So I'm just going to talk to you about a little bit about trans people, who exists, and some of the things that we get asked quite a lot by clinicians, and so some of the things that might come up for some people. So who are transgender people? Trans is, I'm going to also try and kind of keep this a bit short. So transgender people are, people who don't identify with the gender they were assigned when they were born. So baby comes out, doctor says, oh, it's a girl, and then when that person grows up, they're like, oh, actually I'm a boy, or, or the other way around. Or, so it's quite a broad, it's sometimes used as an umbrella to mean something like, all people who have gender stuff going on that's a bit different to what people expected from them when they were born. I'll just try and slow down a bit. Yeah, so trans women are women who people thought were boys when they were born. It's easy to remember. Sometimes people get a bit confused about whether, what's a trans woman, what's a trans man, and things like that. But a trans woman is a woman, so regardless of what people thought when she was born. Woman, she, her, sometimes people use other pronouns like ia, which is the only Māori pronoun, which is genderless, or they might use they, them. They might have transfeminine as a more sort of inclusive term, so people might not feel like I'm a woman, but they feel like I'm definitely not a boy, so it's sort of a bit broader. And trans men are the opposite, so yeah, men who people thought were a girl when they were born, men, he, him, possibly other describing words, and transmasculine is just a bit broader than that. So people who sort of fit into that general kind of trajectory maybe, but might not actually feel like I'm a man. So there are lots of genders that aren't a man or a woman. So that includes like a lot of Indigenous genders that are sort of outside of that scope. And yeah, people who just might feel like not exactly one or the other, but yeah, so their gender is not a binary gender. And they can have all kinds of different words they use to describe themselves, like maybe genderqueer or maybe non-binary, or lots of different ones. Intersex are people whose chromosomes or hormones or different sex characteristics don't match up in the way that people expect for someone to be classified as male or female. And they're born with those intersex conditions, as opposed to like other trans people who might take hormones or have surgeries that makes their body more ambiguously gendered, or or changes those ranges. So for intersex people, it's from birth. It's still reasonably common at the moment that people actually do corrective surgeries on intersex babies if their genitals look different than expected, which intersex activists are really strongly against. So they're saying, we don't need to have that done to us unless we choose it. So yeah, so that's a big one for intersex people at the moment. Are they transgender? Sometimes. So intersex people might say, I was just assigned wrongly or however, and I don't feel like I'm transgender, I'm not transitioning, and if they do something with their body to affirm the gender they are, that's just affirmation and not really transition. And other people will say, yeah, no, I'm totally transgender. Takatapui is a Māori term which often gets used to sort of mean LGBT broadly or rainbow or something along those lines. But it also gets used more specifically to mean gay or lesbian or transgender, or other things like that. And so sometimes, like with the Māori transgender people might not identify specifically with the English words or concepts for gender, like transgender, but they might just feel, they would generally be classified as being transgender. So it's kind of there's no direct translation, but it's takatapui gets used in those sorts of ways. Some people say actually that's about Māori people who have these different genders or these different relationships to each other, or sexual attractions, if you want to think about it that way. And then other people say, well, that's for everyone. That's just Māori words for everyone who's rainbow. There's no consensus on that. So some of the things trans people broadly are dealing with is like a lot of discrimination in employment and housing. People have lots of different issues going on that kind of restricts their ability to stay in one place and have enough income and be able to, if you're sort of floating around, it's hard to even have a GP or things like that. So there's a lot of barriers to healthcare based around discrimination in other areas besides in healthcare. And if they're missing appointments or things like that with their healthcare providers and they're feeling like people think they're lazy or just make bad choices, or they're doing, people might have kind of stereotypical ideas about what trans people have going on. And so that's another thing that we find lots of people say they don't like to go to the doctor because I've missed a few appointments and I feel like people are judging me when I go or things like that. And also, stigmatising language in the clinics. So sometimes people talk about biological women or biological men or things that kind of make people feel like they're less real because, they weren't, assigned the gender that they feel. So there's a lot of things to do with, it's just actually about sensitivity. Like generally speaking, healthcare providers are always really, really, really keen to look after trans patients really well. So it's just sort of, sometimes people need a little bit of, just kind of know the specifics of the issues. And then also there's things like hormone prescribing or things like that that sometimes people just need. Sometimes people just don't feel confident to do the prescribing and things like that. So it's just professional development kind of stuff, I guess. And healthcare, like anxiety, mental health stuff about that. Sometimes that's because of having really bad experiences in the past and feeling, I don't want to go back and maybe have that happen. Or sometimes it's just a general perception. So I think, as time goes on, the general perception of the kind of care that trans people can expect to get is going up. So people are feeling better about what their experience is going to be. So some of the things that can help trans people be able to get healthcare better, it's cost and accessibility. There's so often people just actually can't afford to go to doctors, or they can't afford to get the bus to get across town, or they don't have a phone or whatever. So it's kind of, there's the cost of the actual consultations, and then there's also being in an area where, where people can get there on public transport or... So the clinic, I work at the New Zealand Prostitutes Collective. We have a sexual and reproductive health clinic, and we just text people at lunchtime. Our clinics run from 3 o'clock and 4 o'clock on 2 different days of the week. So we, text people in the morning and we say, can you still come? And if they say no, we're like, that's no problem, don't feel bad about it. Don't feel bad about it, no worries. And just try and fill that gap. So, and we actually find that that's really, really effective because a lot of people just have a bit of chaos happening and might not be able to remember to come. Yeah, so in the clinic, what the clinicians often ask us about is how to talk about pronouns, genitals, the ways that the language is happening. And trans people are often saying, sometimes my provider says to me, well, men's brains are like this and women's brains are like that, or they have opinions that they will say, and that's not really helpful. So we sort of say, being really clear about also what's needed and why it's needed. So sometimes people are still having things like just invasive questions that are nothing to do with the healthcare being asked. Or there was one woman recently who was at the hospital for a broken leg, and and she said the person doing the care looked at her chart and was like, "Ah, so you're transgender, huh?" And she was like, "Whoa, nothing to do with having a broken leg. Why are you bringing that up?" So there's sort of situations where people just are curious and don't necessarily remember that you got to keep it really focused, because it might seem like a rarity to have a trans person come in, and you might sometimes feel like you want to ask them questions, but for a trans person, that's probably every time, probably most times when they go most places, people want to ask them about it. And the professional development stuff, I think everybody knows about. So the questions that we most commonly get asked is, how do I ask if someone's got a penis or a vagina? Just don't. So if it's a sexual health clinic or something and you need to do swabs, like the clinicians that I work with will just ask people, which swabs do you need? Do you need throat swabs or do you need anal swabs? And also, because we're working with sex workers, we do a lot of, we ask really specific questions, because you can't just assume how people are doing sex. Even though sex workers actually use condoms more often than people who aren't sex workers, but you have to just kind of make sure that you're really getting everything that you need to get. So and if you're asking those kind of questions, the person can answer without having to say a word they might feel really not comfortable with about themselves. Sometimes, it's just the sort of how to ask what direction the patient's transition is. I remember seeing my GP and saying, actually I'm trans and I want to kind of do something, and he was like, "Oh, okay, do you have and I'm like, you've been my doctor for like 3 years, you probably actually already know, but it usually doesn't matter, because unless when you get to the point where you're asking them about what sort of treatments they want, it's going to become really obvious if they're saying, I want to take estrogen, or, those sorts of things. And instead of saying, somebody used to be a girl or used to be a boy, you can say they were assigned female when they were born, or they were assigned male when they were born. So same with the old terms male to female and female to male. Lots of people feel like they were never whatever it was they were assigned, and so just a trans woman or just a trans man or something like that is more comfortable.